Are you someone with back pain who struggles to bend forward to reach towards your toes? In this video, I'm going to provide you with a valuable step-by-step spinal flexion progression to help get you moving more confidently. So in my experience, people tend to struggle with this movement for two main reasons. Firstly, the movement does place some emphasis on structures in the back that are often irritable in people with back pain. So performing this movement might just feel a little bit achy, stiff, limited, or even painful in some cases. The second reason is that people with back pain often develop what we call fear avoidance behaviors in relation to this movement. There are unfortunately some unhelpful cultural beliefs relating to back pain that lead a lot of people to believe that this type of movement is unsafe, dangerous, or potentially even damaging to their back. This fear of performing the movement can exacerbate the muscle guarding intention that's making the movement challenging, and it can also cause people to completely avoid doing the movement. So over the course of a period of time, they do the movement less and less and less, therefore making it more challenging. And of course, over a period of time, if you stop performing a movement, you reduce your ability to do it. If you don't use it, you lose it. So this fear avoidance can lead to a bit of a detrimental spiral of deconditioning, making the movement even more painful, even more uncomfortable to perform. It's important to note that spinal flexion, bending forward, is a perfectly safe and normal movement pattern and can be essential in everyday life. So using this spinal flexion progression will help you gradually reintroduce this movement to your body, preparing you both physiologically and psychologically, and get you moving freely and with confidence. The first step of this process is supine, or lying on your back, pelvic tilting. So you're going to assume a comfortable position, probably on the floor or on a soft floor is best, with your knees bent and your feet on the floor. And what you're going to do is gently press into the floor to allow your pelvis to tilt forwards and back. And you should feel your lower back somewhat pressing into the floor. Now, if you can't feel this, place your hand under your lower back, like I've done here, and you'll be able to get a bit more biofeedback, a bit more proprioception. So try and press gently your lower back into your hand. The second step of the progression is still lying on your back. And what you're going to do is bring one knee towards your chest. This is a gentle stretching motion, but as you can see, by bringing the knee to the chest, you are gradually introducing spinal flexion to the body in a very safe and comfortable way. Do one side and then the other side. Make sure you do them equal amounts. The third step of the progression is very simple. Simply bring both knees towards your chest. This will require you to have a little bit more spinal flexion than doing one knee at a time. So we're gradually building on the body's ability to flex the spine comfortably and safely. In the fourth step along this sequence, we're going to move now to the quadruped position, or on your hands and knees. This starts to gently challenge the spine a little bit more by adding a bit of gravitational difficulty to the movement. You might recognize this movement from Pilates or yoga. It's sometimes called the cat-cow or cat-camel. Basically, you're going to drop the head and flex the spine upwards, getting a nice gentle stretch, and then reverse the movement. Allow the spine to go into extension while you raise your head back to the sky. The moving stretch, quite gentle, and should feel very safe. For the fifth progression, we stay in the quadruped position, and we're going to introduce gentle rocking, which of course requires flexion of the spine. This is a favorite of ours in clinic. What we're going to do is start in the quadruped position, and then we're going to drop our hips back onto our heels and allow a gentle stretch into the lumbar spine. As you can see from the video, doing this requires a fair amount of spinal flexion, but of course you're not really working against gravity, and it feels very, very safe and very easy. As I'm doing here, you can do this as a held stretch in that position with your hips back on your heels, or of course you can do it as a moving stretch, rocking back and forth as you feel comfortable. For step 6, we're going to move into a supported seating position. So this allows us to really start to simulate real-world spinal flexion. However, we're only using half our body weight, and of course, being on the chair feels much more comfortable and much safer than being in a standing position. So what you're going to do, you're going to be in a comfortable chair and just gradually flex your spine forward as far as you are comfortable. When you're coming up, be a little bit cautious. It's not dangerous, but if you want, maybe start by walking yourself back up with your hands, as I do in the video. Or you can use rolling your hands up and down your legs, so you've just got a little bit more support. Or eventually, when you feel ready, you can go into full spinal flexion without using your hands, as I do here, just using the strength and mobility of your spine to perform the movement. Step 7, and we're almost at full flexion here now. We're going to go to the standing position, and we're going to perform spinal flexion, but with one foot in front of the other. This gives us just a little bit more support and a little bit more comfort, placing a bit more of the load down into the leg rather than placing it all on the lower back. So you're going to put one foot in front of the other and flex forward, focusing on that side, the front leg side, and come back up, switch your feet, and then perform the same spinal flexion, but with the other leg in front. And then step 8, the final step, full standing spinal flexion. So what you're going to do is stand with your feet at a comfortable width, around shoulder width. Knees don't have to be completely locked, they can be soft, but try not to bend them too much. And then just gradually lean forward to try and reach towards your toes. After performing the earlier steps, this should now feel very comfortable and very safe. Please recognize that the goal here isn't necessarily to be able to touch the toes. Some people, due to their biomechanics, limb length, and so forth, they simply can't do that, and that's absolutely fine. What we're looking for is comfortable movement that feels safe, secure, and wonderful. For those of you who want a little something extra, and I know a lot of the patients I've been seeing recently certainly fall into this category, I'm very proud of all of you, you might want to try this extra exercise, often referred to as the Jefferson curl. And what this is a loaded standing spinal flexion on a slightly elevated surface. So what you do is do as I do here, simply stand on a slightly elevated surface, a couple of inches is fine. I'm using a weighted plate here with some sort of resistance in front of you. Here I have, I think, a 4 or 6 kilo kettlebell. It shouldn't need to be heavy to get the benefit. And what you're doing is performing the spinal flexion under a little bit of load, which can help even more stretch out those tight and immobile tissues, get a little bit of extra range of motion. And of course, when you're coming up, we'll build the strength of this movement very gently and very safely. Remember, with this progression, we are looking for fluidity and comfort, not speed. Everyone tends to progress through these steps at their own pace, and there's no need to rush it, and there is no prescription for how long you need to stay at any one step until you move to the next step. You move to the next step when you feel comfortable and ready for yourself. So if you're someone who struggles with flexing your spine, bending to reach forward, give that spinal flexion progression a try. I hope it helps build your confidence with movement so you're able to tackle everyday life with ease, comfort, and without any pain. I hope you found that information useful. Remember, you have the power to take control and move towards a pain-free life. If you enjoyed the video, please give it a like and consider subscribing to the Back Pain Guide for future videos and more valuable content. If you have any questions or perhaps suggestions for future videos, please leave them in the comments below. I'm here to guide and support you on your journey to recovery. Thanks for watching the video, and I'll see you in the next one.